I think the big problem is, how do people find out about these minimally invasive options for treatment? How come my doctors never told me about this? How come I don't know what GAE is? Now that embolizations, to me, I feel like we're just barely scraping the top of the surface. Everything is a touch of a finger on the phone. They're looking already for that specialist before even talking to their primary care about it. I want to know what's next. I want to know what is coming down the pipeline. What motivates me every day is I love to help providers grow. I think providers should choose patient pro marketing because Hi, my name is Rachel Beesinger. I'm the CEO and co-founder of Patient Pro Marketing.
What is Patient Pro Marketing and why did you start it?
We started Patient Pro Marketing mainly to bring awareness about certain procedures and minimally invasive treatments that were out there. There's a lot of providers that offer really cool, minimally invasive, life-changing procedures that patients just don't know about. So there's this disconnect between the patients learning and understanding these procedures and the providers being able to touch and educate people on it. So with Patient Pro Marketing, we decided to go ahead and bridge that gap by bringing out more awareness, talking more about these procedures, doing the paid marketing, and really targeting who we need to get this information out to, really.
What problem are you trying to solve?
I mean, again, it takes us back to awareness. I think the big problem is, how do people find out about these minimally invasive options for treatment? You know, we've talked to patients all the time who are told they need like a major surgery. Let's say it's a total knee replacement. And when they come to us through our ads, they literally will say, how come my doctors never told me about this? How come I don't know what GAE is? I've never heard of this before. So for me, that's the number one goal, is for us to make everyone more aware of what their options are.
What makes Patient Pro Marketing different?
Well, at Patient Pro Marketing, we're not just marketers, right? We get that a lot. Are you an ad agency, a lead gen agency? What do you do? We are really, and this might sound kind of cliche, but we're the Patient Pro family. We really take care of people from the beginning of when they see an ad come through. We click with them, right? That pain point, what's hurting, what's bothering them. Let's say we're talking to a woman with fibroids. She's been told she needs a major surgery, like a hysterectomy. She may never have children again. Her options are not the best. So when she sees an ad that comes through for a minimally invasive treatment like a UFE procedure, we get that woman on the phone and sometimes we're crying together. She's telling us her stories, the things that she's gone through, what she's missing out on in life, how detrimental this has been for her, not just physically, but also emotionally. We really build that empathy and trust with people that once they finish their conversation with us, they're educated. She knows her options. She knows what to expect. And then the next step is to hand that over to the provider.
Why do embolization practices require a unique marketing approach?
I think embolization practices require a unique approach. It has been around for many years, right? It started in Japan, probably in the early 2010s, something like that. But it's just really making its statement and footprint now in the United States. It started with like GI bleeds and some trauma type things, but now these interventional radiologists and vascular surgeons are using embolizations for all kinds of pain therapies, whether it's MSK joint pain, uterine fibroids, enlarged prostates for BPH. There's liver, there's thyroid embolization. There's so many different things now that embolizations, to me, I feel like we're just barely scraping the top of the surface.
What's the biggest mistake providers make when trying to grow?
The biggest mistake providers make while trying to grow, I don't know if I would say I'm an expert there, but I will say limiting themselves to certain practices or certain procedures and not being open to exploring different options, right? Like, if you're an interventional radiologist and you open a PAD clinic, you're focused strictly on peripheral arterial disease and venous. You're missing out on so much more of that patient. Most patients who have diabetes and PAD probably likely have osteoarthritis in some joint or will eventually get it. So I think by having that like tunnel vision and not really opening up more ancillaries, more services, and just in general more conditions to treat, you really are kind of like choking your potential with volume, growth, scaling, and everything else.
How has patient behavior changed?
So patient behavior has changed a lot. I think with technology and social media, people before, You went to your primary care doctor and that was the holy grail. Whatever Dr. So-and-so said you had, you did. You didn't question it. You didn't know any better. You didn't have resources. Now everything is at a touch of a finger on the phone, right? You can go to AI, Google. There's so many Reddit, there's groups, support groups for people who have these things that patients have now. So I think 100% patient behavior has changed. And I think that's why it's super important, again, to be on the social media pages to bring awareness, because patients are using it to learn what their options are.
Why is patient education so important?
Well, patient education is everything. I just said it in the last question, right? Was patients want to know what their options are. They're advocating for themselves more. They're not just believing what the doctor says. But I believe that, if you're a really good provider, a good physician, and you take care of the patient holistically or you're honest with them about what their options are.
What's more important, leads or appointments?
What's more important, leads or appointments? I think you have to have one to have the other. Okay, so you have to have leads to get the appointments. At Patient Pro Marketing, though, for us, the end goal is to schedule a confirmed, qualified appointment. So we want to make sure we're getting you patients who have the right type of pathology that you're asking for, and possibly the right insurance, and making sure we're truly sending you a great candidate for the appointment and not just filling your schedule with names and phone numbers.
Why are show rates so important?
So show rates are everything. Without the patient showing up in the clinic, what do you have? You have, again, a name of list and phone numbers and nothing really. So show rates are really important. That is something at Patient Pro Marketing that we work really closely with all of our partners with. We have an account manager that meets with the team weekly and just goes over best practices. What is that handover like? Once my team is done making that appointment and confirming it, now what? Has the front desk reached out? Did they do a welcome call? Did they reach out and welcome that patient to the practice? There's a lot of skepticism still when it comes to social media and Facebook advertising. Patients will think after they hang up the phone, oh no, did I just get scammed? Who did I just talk to? I just gave them all my insurance and everything else. So that's why that handoff is super important, to kind of legitimize the campaign, who you are, start building that rapport and foundation with the patient, between the patient and the practice, and your show rates will be much, much better.
What have you learned from working with providers across the country?
So I've worked with providers almost my whole life, from different aspects, I used to sell diabetic shoes, DME, pathology. I've done a lot. Working with OBLs and ASCs across the nation, I think for me has been really exciting, because again, I feel like this is a part of medicine that is just scratching the surface. I think interventional radiologists or IRs are just now leaving the hospitals and building their practices and starting these outpatient labs that offer better access to patients at a lower cost. So insurance rates and fees will go down. The outcomes are better. Think about if you had to have a major surgery or, an arterial intervention. If you go to the hospital, you're also dealing with every other sick person that's coming in the door, probably long wait lines. They're going to charge you an atrocious amount of fees between facility fees, hospital fees, doctor fees. You're probably going to have to stay the night. They probably have all these ridiculous protocols. And then you're probably in a recovery room with some stranger that snores all night. Like, it's going to be a terrible experience. Where if you can access an OBL, where an interventional radiologist has a beautiful outpatient facility, you check in, they take care of you, it's just you, you're in, you're out, you go home the same day, and the follow-up is better because it's a private practice. I just feel like that's much better for patients.
Why do you feel that awareness campaigns matter?
Awareness campaigns are everything. I think that's how you reach people, and that's how you educate, and that's really how people may not even need these procedures, but the fact that we can be on their phone when they're scrolling, they could see something that maybe their family member is suffering from. You're on your phone and you just realize you and your girlfriend were just having brunch and she was talking about how severe her cramps are and her cycles are, and you could be like, hey, maybe she's got fibroids and should look at this other option. So I think it's really important to have awareness campaigns, and I think that's true for more than just what we do here at Patient Pro Marketing.
What excites you most about healthcare marketing?
I think what excites me most about healthcare marketing is I've been doing this for a long time. And 20 plus years ago, I was your traditional clinical liaison, boots on the ground. I was a hustler. I knocked on doors. I've been the Starbucks queen of pickup, lunch cater queen, whatever you want to call me, road warrior. I mean, we used to sing songs about being on the road all the time and doing those things. The traditional way of referral patterns has changed. I think most people, most physicians and practices are catching on to that now, hence why there's so much more digital marketing for healthcare versus the old school. I still think face-to-face works really good. I still believe that you need to have that handshake, that someone to walk in, bring a warm smile, here's some information about what we do. But I don't think it's what drives the needle anymore, and I don't think that's what gets the patients in the door. I think patients now, knowing, again, with the resources they have, the phone in their hand, they're looking already for that specialist before even talking to their primary care about it. So if you're a specialist, an IR, someone out there that has something to offer, like a minimally invasive option for something major, a prostate, a euphy, a knee replacement, whatever it might be, I think it's stupid to not use digital marketing, whether it's paid per ads, SEO, website. There's so many different versions and platforms for digital marketing.
What motivates you every day?
What motivates me every day is I love to help providers grow. I love helping them grow their practice. I love helping people too. You know, I think by having these awareness campaigns out there, the stories we hear from patients, even after they've gone through our entire cycle of, you know, talking to our team, booking their appointment, going to that provider's office, having the treatment done, I think the best feeling for me is when they come back through our funnel and say, I'm so glad I saw your ad on Facebook because now I can walk without pain. Or I'm so glad you came through on my feed because now my husband can sleep through the night and have to get up to go to the bathroom 15 times. I think that's what makes me really happy.
Okay, and besides helping providers grow, what is your vision for patient pro marketing?
I mean, many of you know, it took a wild, crazy turn at the end of the year, but we've been here since December of 2024. It's been a crazy ride. We have just partnered with so many amazing interventional radiologists, vascular surgeons, interventional cardiologists. There's so much support that comes from this community. And between, you know, partnering and networking with organizations like OEIS or GUEST, I feel like there's a lot of synergy between us. And I just want to continue growing that with providers. I want to know what's next. I want to know what is coming down the pipeline that providers are like, man, there's this really cool thing coming up and we want to do it, but how do we get the patients in the door? Like, that's what I want to help doctors do. I'm just so excited for what's coming. I just got back from GUEST a couple weeks ago. It's the Global Embolization Symposium meeting in New York. And getting to meet Dr. Okuno, who is like the godfather of MSK embolizations, that was pretty cool. But also just seeing how many providers worldwide are doing embolizations and the difference that they're making for people. Like, I just can't wait to see what's next and how else we can be involved with it.
So why should a provider choose patient pro marketing?
I think providers should choose patient pro marketing because we are, again, more than just an ad agency. We want to be a true partner with you. We are a very young company. We are still growing, and I want us to grow together. So if I can find a provider who is either struggling with the traditional old school referrals, or they want to grow an embolization program, but they don't know how to get the patients in the door, I want to be a resource for them. I want to be a partner. I want to help them sit down, you know, and talk about your goals. Like, I never just take a phone call and say, okay, let's sign me up. I'm ready to go. Like, I want to know what drives them. What are their goals? What do they want to do after XYZ, right? Because they're going to come to me and say, hey, Rachel, I want to start a GAE campaign, or I want to do frozen shoulders or euphies, whatever it might be. But I also want to know what's next and what's the future look like, because I want to have a long-term relationship with them as well. So anything that we can do to grow together is kind of my main goal there.
Okay, and what would you tell a practice that's struggling to grow?
I think I would tell a practice that's struggling to grow, like, really break down what works and what doesn't work, right? Like, what should you keep and what should you get rid of? I think a lot of providers get stuck in this kind of old school mentality, and please don't take that in the wrong way if you are old school, because I'm old too. What I mean by that is, like, when they do something, it's hard to make to change Nobody really likes to change. And when you have to change, it's uncomfortable. And like this whole digital marketing world is new for a lot of people, right? There's still doctors with paper charts. There's still doctors that may not even ever had a clinical liaison or done any marketing. All they have is a pamphlet and they're like, why aren't my pamphlets working? So I feel like you have to step over that line and get a little uncomfortable. Go with a change, see what you can figure out, and just, I'm here as a support. Like I would love to sit down with somebody and say, what have you tried? What have you not tried? Because we do get told a lot. I've tried digital marketing, didn't work. Well, what didn't work? Well, we just got a bunch of names and no one answered the phone. Well, yeah. What was your process like when you got the lead? Well, we would get them on a Monday and the girls would work them on like Thursday. So like for us, speed to lead is important. I mean, that's one thing when you come to digital marketing is making sure when a lead comes in, it's hot. While it's fresh on their mind, you want to get them on the phone and close that gap before it's too late.
Okay, thank you for meeting with me.
No, yeah, thank you for this opportunity. I just want to sincerely send a thank you to all of our partners and clients and people who have supported us this last year and a half. It's been, again, like I said, a wild ride and very exciting. I'm looking forward to what we can do with all of our providers and clients this year, next year. I mean, today we just did a big media day. We had a lot of fun, lots of new creatives and things coming down the pipeline. I'm truly grateful for the opportunity to be here and help people.